An expectant mother wants good advice how to stay healthy during pregnancy and what is best for the baby. And who better to hear from on this subject than my friend and colleague, Dr. Cara Hartman, who is now expecting her second child. Here's Dr. Cara Hartman.
Lifestyle choices made during pregnancy can have major impacts on both you and your baby. This topic is especially dear to me, not just because I'm 29 weeks pregnant, but because I see women every day in clinical practice struggle with pregnancy-related issues that can sometimes be prevented, or at the very least minimized. Professional-grade supplementation, micronutrient testing, eating a balanced diet filled with organic fruits, vegetables, and proteins, getting plenty of exercise and sleep all contribute not only to the next 40 weeks of your life, but also your baby's life. I would like to see women everywhere increase awareness of their health and take supplements regardless of being pregnant. Yet the reality of pregnancy is it can either lead to an increase in health-conscious decisions or quite the opposite, creating an uphill battle for us after the baby is born. The importance of choosing the right professional-grade supplementation usually isn't addressed at your doctor visits and is often left up to you to determine the right supplements for you. The biggest distinguishing factor between the grocery store and those prescribed from your wellness physician is the quality control and potency, and therefore the efficacy of how they're absorbed in your body. It is critical patients understand that not all supplements are created equal, and it's important to speak to a licensed wellness practitioner about your nutrition during your pregnancy, and not just your neighbor down the street. The sophisticated technology used in prenatal packs, for example, tests all incoming raw materials and ensures potency, which I think is the most important. You may ask yourself, for years, women have taken over-the-counter vitamins and still have healthy babies. But the question I really want you to ask yourself is the health risks and complications of those babies as they grow. Are they more prone to colds, flus, runny noses, ear infections, skin reactions? It's likely they are. Problems during pregnancy have strong connections with our diet, especially nausea in the early trimester. I'm sure many of us wish the term morning sickness meant we had the rest of the day to feel great, which is rarely the case. Sometimes nausea and sickness can last all day for weeks and weeks. Chemical byproducts of hormonal changes, if allowed to build up in the body, can cause morning sickness. Walk a mile a day to prevent morning sickness. Increasing available iron and B vitamins through the diet and supplements can help prevent a vitamin B6 deficiency, which is also a key contributor to morning sickness. Muscle and leg cramping in the latter part of pregnancy is often associated with a lack of calcium, which should be attained through both professional-grade supplementation, exercise, and an assortment of leafy greens. The increasing weight of the growing fetus causes a shift in the center of gravity and therefore movements of our bodies. There are no safe medications to take during pregnancy to relieve backaches. So why not prevent or minimize them through intelligent food choices, exercise, abdominal and pelvic floor strengthening? Good posture, regular exercise, and chiropractic visits will establish a new center of gravity with less muscle and joint pain. Heartburn, or any sensation of pain, heat, or acid burning in the esophagus with eating, may be caused by nervous tension, excess production of stomach acids from dietary choices, relaxed stomach muscles allowing food to back up, or even the stomach being pushed upward by the growing fetus. The commercial remedies for heartburn are contraindicated during pregnancy, yet natural remedies are often more effective and increase prevention. Eating small meals frequently, such as nuts or dried fruits, can help. And chew your food slowly. Don't drink while eating, yet consume plenty of water in between meals. Avoiding coffee is beneficial, in addition to eliminating specific foods you notice produce heartburn. We perform a lot of food sensitivity testing at the clinic to help women easily identify and eliminate their food triggers. A bonus of food sensitivity testing is it also improves the quality quality of mother's milk and decreases inflammation in the baby once they are born. Preeclampsia is one of the most serious yet preventable complications of pregnancy. The symptoms usually appear after the 30th week of gestation. Edema, hypertension, protein in the urine. These symptoms have a strong connection between deficiencies and malnutrition during pregnancy. Proper protein intake, adequate salt and calcium intake are encouraged. There are also specialized micronutrient blood tests we use in practice that can measure the function of 35 nutritional components, including vitamins, antioxidants, minerals, and amino acids within our white blood cells. Scientific evidence shows that analyzing the white blood cells gives us the most accurate analysis of a body's deficiencies. This can ensure you're getting the proper nourishment that you and your developing baby need to live a life of health and happiness.
Unfortunately, studies show OBGYNs have inadequate training in nutrition. You can do the research, educate yourself, and if you have questions, talk to your wellness professional about prenatal vitamins and prenatal care.